Hello, welcome to HealthEast Grand Avenue Clinic. This is the front entryway coming off Grand Street, or Grand Avenue. So patients may park on the street and enter to our clinic through these doors and coming through this corridor. We'll have screening on the windows here to protect the privacy. The waiting room will sit on the other side. There'll be frosted glass through here. The entry to the clinic will be right here, and we'll have frosted glass along both parts here with new doors coming into the clinic, and all the patients will enter through here. The other entryway will be through the elevators, which are down here. And there's also a stairway. The elevators have access to the parking ramp. And there's 2 levels of the parking ramp. And we'll also have the shaft of the elevator painted, and we'll have a HealthEast logo, so as patients and other non-patients are coming up and down the elevators, they'll see the HealthEast painted within the elevator shaft. So the top parking level is up here, has about 110 stalls. And as you can see, is not used very much. There's right now 1 car here at their somewhat peak time during the day, which is the noon lunch hour. The parking deck overlooks Grand Avenue. So you can see Grand Avenue right here, and our entrance is directly below us. Then there's another level parking directly below that we'll stop and take a look at. Actually, we'll take the stairs, because there's stairs as well as the elevator. And the stairs will go all the way to the hallway to get to the clinic. So parking level 1 is covered and is used more frequently. And you can see it's about probably a little more than half to 3/4 full in the peak time during their day. Each of the parking levels has about 100 parking spots. So patients will come off the elevator or the stairs, which are around the corner, and come into the clinic. And we'll also have some HealthEast logos on the windows out here so that patients will be able to identify where we're at. So coming into the clinic, the reception desk will be, and this is where we'll have to use our imagination. This is the future home of the HealthEast Grand Avenue Clinic. And it'll look a lot different in a couple months. Our waiting area will be here to the right, and it'll be against the windows there and up to the windows there, and then we'll have a wall coming down here. We'll have our reception area will be sitting in through here, so patients will come right in the door, stop at the reception area, and then be able to go back and sit in the waiting areas. There's dividers to separate for privacy between the reception desk and the waiting area. Then there'll be a corridor that comes through here, a bathroom for patients here, drinking fountains. And then we'll come through a door, there'll be a reschedule area, vitals, and then our administrative offices are going to be off in this area, so we'll have Elaine's office, the lead's office, and the business office will all be sitting out in this area. And as we come down the corridor, our lab will be on the left-hand side, and we'll have a conference room sitting to the right, and then X-ray will be at the end of the corridor. And across from the corridor, there'll be a nurses' clinical support staff station. Then it'll open up into a hallway of exam rooms that'll wrap around with a clinical support station located in the corner down here. And we'll have exam rooms all the way along here, all the way along here, and wrapping around to the employee break room, physician offices, procedure rooms on the corners here, and then there'll be a corridor that comes around with an office, and there'll be a small external corridor that allows for the retail space that's remaining up front to access to the back. So then our space wraps all the way around through here, exam rooms, use your imagination, all through here. Then there is a elevator for us to use to be able to get to the lower level, which is right here. So this elevator will give us access to the medical records that'll be in the basement. There's also a stairs that we can get to, which is back, I believe, through this way. So then we'll take a look at what's downstairs. So now we're in the lower level, which will have our medical records, our IT room, housekeeping, and an electrical room. So we'll be able to come down the elevator, you'll come off the elevator, and our medical records will be straight ahead and walk into that. This will be our IT closet, and where we'll have all of our phone and computer equipment, and then we'll have a small housekeeping. So this will look dramatically different down here. We'll be taking out these walls, reconfiguring it, but it'll be a small amount of space with basically our medical records occupying the largest piece, which will go back through there.